many modern jobs can be done from a desk, and this type of work has led to more sedentary behaviors. To discuss with me her recent research, not only on sedentary behavior, but also physical activity and health, is Professor Melitta McNarry from Swansea University. Melitta, thank you so much for taking the time today. It's great to have you on.
Thank you very much for inviting me, Alison, to have a chat today.
Melitta, you write that in a recent paper that employed adults in the UK typically spend between 60 to 80% of their working hours sedentary. And of particular concern is that desk-based workers in the UK spend over half of their time in prolonged bouts, so either 30 minutes or 55 minutes. And you also looked at how we can potentially reduce the sedentary time by alerting people via a smartphone or a wearable device so that they break up their sitting. Are such alerts an effective method? And if so, how frequently should such alerts be sent?
It's a fascinating question, and certainly one that's a lot of attention in the research world at the moment. Technology can go so far, and it has certainly opened up a lot of opportunities for allowing us to intervene in these types of behaviors. So one of the key questions is it an awareness? So do we just need to make people more aware of the time that they spend sitting down and the periods of time that they spend sitting down? Or is there more that needs to be done? Do we need to facilitate the ability to make changes to those behaviors? Technology has enabled us to make many of those changes. So for example, there's things you can do with people's computers. You can force them out of their applications so that they have to stand up. Doesn't tend to be particularly well received, that one. There's a whole raft of wearables which can give you nudges and prompts to get you to stand up, perhaps to do some movement. And they've had varying levels of success. I think perhaps the greatest consensus to date is that one single method isn't going to be enough to change these behaviors. So just a wearable or just a software on your computer isn't going to be enough to elicit sustained behavior change. It might cause you to change your behaviors over the period of a week, a month, a couple of months even, but ultimately you will regress back to your pre-intervention behaviors. What has shown to be far more effective are multi-component interventions. So interventions that have perhaps the wearable technology, they have some kind of peer support element, and pivotally, they have employer buy-in as well. So one of the greatest barriers in the workplace to breaking up our sitting time is a prevailing perception that as soon as we stand up, we're no longer working, we're not being productive, we're wasting our time. So if we can change that perception, if employers can actually realize that maybe they aren't doing something during those 30 seconds, 3 minutes, but they will then be more productive when they are sat back down, and over a sustained period of time, they will be significantly more productive with fewer sick days and all the things that go with that, then that's the kind of mentality we really need to get in place. In terms of the frequency of breaks, that's really a question that we haven't been able to answer. And I think it depends. In a lab-based environment, we've probably got a pretty good idea of the regularity of breaks that we should look for, but how they then sit within a real world context has proven to be significantly more difficult to untangle, because obviously the best intervention is the one that people will actually do. So we might know that breaking up your sedentary time every 30 minutes is ideal, but if no one's going to do it, it's not going to have any effect. So maybe we have to go with a compromise solution of every 60 minutes or whatever duration it might be. And if people will do that, then it's going to be better for their health.
And you also looked at adolescents. So some of your previous research has shown that also physical activity and cardiorespiratory fitness are linked to mental well-being also for adolescents. So how do you see technology playing a role in addressing sedentary time in that population? So is that also something that is important?
Yeah, technology can definitely play two roles in this relationship, in especially adolescents. So we are well aware of the potential negative effects of technology, where it actually promotes sedentary time or sitting time, where it engages us in activities that don't require significant energy expenditure. So there's a negative side to technology, but undoubtedly it does have its merits and its strengths, not least of which are its engaging nature and the fact that it's something that adolescents want to be engaged with. If we keep coming to adolescents with interventions that require them to relinquish their highly valued behaviors, they're never going to do them because they're the behaviors they think are the ones they want to engage with. We have to give them an alternative that they enjoy, that they value, and that they therefore will do in the long term. And technology is one of the best options we have for that. So I think there's a lot of options where technology can help, but it's a minefield as to how to achieve that without any detrimental consequences occurring elsewhere in the daily physical activity patterns.
You also did a recent study where you looked at mental health and well-being in the UK and New Zealand. And can you maybe speculate as to why New Zealand had better mental health and well-being compared to the UK?
Yeah, so this was a study actually led by Professor James Faulkner from Winchester University. And as you say, it came up with some really interesting findings. Normally, pre-COVID, mental health was actually lower in New Zealand than Britain and Ireland, but we found the reverse true during this early phase of the COVID-19 pandemic. The suggestions that we came up with to explain those findings were related to the maintenance of behaviours at the onset of the pandemic. So in the UK and in Ireland, people typically reported a significant reduction in their activity levels, in their activity-related behaviours, whereas in New Zealand, they didn't report any change. And we know how beneficial physical activity is for mental health and well-being. So we speculated that it was their ability to maintain those behaviours that enabled them to also maintain their mental health and well-being.
You mentioned also, obviously, COVID-19 there. You looked at inspiratory muscle training and the benefits for this, for the recovery from COVID-19. Can you give us some more information on that and what you found there?
Yeah. So inspiratory muscle training is a method of specifically focusing on training the muscles involved in breathing in or inspiration. The rationale for this was when the early reports of COVID and especially long COVID started to come out, breathlessness was one of the primary symptoms that was very commonly reported. And prior to COVID, we've been doing a number of studies in different chronic respiratory conditions, such as non-cystic fibrosis bronchiectasis and in cystic fibrosis, looking at the potential utility of inspiratory muscle training to strengthen those inspiratory muscles and thereby reduce the work of breathing and improve quality of life. So when these early reports came out, we thought perhaps there's a potential role here of inspiratory muscle training as a rehabilitation tool. And it was especially appealing because it was able to be done remotely and home-based, which obviously at the time that we started the study was especially important. When there were no long COVID clinics around, there was very little understanding of what long COVID was or what the appropriate treatment or rehabilitation strategies were. And people were just crying out for something that they could try that might help them recover. So we conducted this study. It involved participants doing 8 weeks of inspiratory muscle training. They only had to do it 3 times a week for about 20 minutes at most. And then we measured them pre and post to see what effect it had on many parameters, but the primary ones being their breathlessness and their quality of life. And we found that there was a significant reduction in people's perceptions of their breathlessness, and that was associated with improvements in their functional capacity, in that they increased their habitual physical activity, they increased their estimated cardiorespiratory fitness. Obviously, it was done remotely, so that is very much an estimate of cardiorespiratory fitness. But one of the other things that did come across from the study was the heterogeneity associated with long COVID. So whilst on average, inspiratory muscle training was very beneficial, it's not to say it worked for everybody. And we did have a significant number of people who didn't complete the study due to factors such as they found an alternative intervention or they just simply didn't complete it. So I'm not trying to say that inspiratory muscle training is the one solution to long COVID by any means, but much as we're sedentary time, we need to come up with multi-component approaches. Inspiratory muscle training definitely has its place as part of a holistic approach to trying to help the over 2 million people currently estimated to have long COVID in the UK alone.
Melitta, thank you so much for all your answers and for your time, and best of luck with your further research. Thank you.
Thank you. It's been a pleasure to talk to you.